On Wednesday, Merck and Moderna announced the first successful late-stage trial of an mRNA cancer therapy in history. The press release did contain hazard ratios, two of them quoted precisely with confidence intervals. They were both from a different trial, not the one being announced, an older one, a smaller one that had already reported years earlier. For the trial that actually made history, the phase 3, the confirmatory one, 1,137 patients. The release contained no hazard ratio at all. I am Vikas, your host. This is what changed from VYNG. We don't chase headlines, we explain what changed. Three lines in a row. The headline, the first individualized, the first individualized mRNA cancer therapy in history has passed a phase 3 trial against the standard of care. And the reality is that statement is very true, and the word does not yet know by how much. No hazard ratio, no confidence intervals, no p value, no survival curves. Well, its overall survival still immature. So the direction of the effect was published, the size of it was not. And the size is the entire commercial question. So let's take this in layers from the most quotable version of the truth down to the most complete one. The layer one, the headline. Merck and Moderna said the phase 3 Interpath 001 trial met its primary endpoint of recurrence free survival and a key secondary endpoint of distant metastasis free survival. Recurrence free survival is simply how long a patient goes after treatment without the cancer coming back. That is a real result. It is genuinely the first time an mRNA based cancer therapy or any individualized neoantigen therapy has won a phase 3. And it did it against an active comparator, not against a placebo, against Keytruda, which is already the standard of care for these patients. Beating a placebo is a low bar. Beating the best available treatment is a much harder one, and they cleared it. And layer 2, the narrower version, you can say, this was a pre specified interim analysis. The trial has not finished, it is still running, still collecting other endpoints. And the most important of those, overall survival, whether patient actually lives longer, was explicitly described as not yet mature. And layer 3, the complete version. Here is what the release did not contain: no hazard ratio, no confidence intervals, no p value, no Kaplan Meier curves, no absolute numbers of how many patients in each arm had their cancer returns. Here is the analogy. I want you to hold for this again for this episode, and it's the only one I'm going to use. Well, these type of analogy I'm using in every episode, so you need to stick this rest of this episode. So imagine your child sits a major public examination. Weeks later, an envelope arrives from the examination board. You open it and it says one word: passed. That's it. No score, no grade, no rank, just passed. Now, passed is genuinely good news. It is unambiguously better than the alternative. You should be pleased. But you do not know whether your child scrapped through on the very last mark or topped the entire year. Both of those results produce the identical envelope. The word passed is compatible with an enormous range of underlying performance. And everything that happens next, the university place, the scholarship, the offer, all depends on entirely on which end of that range you are actually at. That is exactly where this trial sits today. Statistically significant and clinically meaningful. That is the envelope. It is the word passed, and a hazard ratio of 0.85 and a hazard ratio of 0.45 both produce the same sentence while describing two completely different medicines, two completely different labels, and two completely different companies. Now, here is the part that makes this genuinely unusual, and it's the reason we are covering it at all. The same press release did print hazard ratios to three decimal places with 95% confidence intervals. For the earlier phase 2B study, Keynote 942, a 49% reduction in the risk of recurrence of death, a 59% reduction in the risk of distance spread. Okay, so to go back to the envelope, the letter did not tell you this year's score, but it did helpfully remind you that in a practice exam some years ago, your child got 90%. The mock result is in the envelope, the real one is not. Three reasons the gap matters more than it might sound. The first, the magnitude is not a detail, it's the whole model. When a analyst builds a forecast for a drug like this, the hazard ratio is the input that drives everything downstream. How broad a label regulators will grant, which patients get treated, what payers will reimburse, and therefore what peak sales look like. Without it, every revenue forecast you read this week is built on an assumption, not a disclosure. And you can catch that happen in real time. The most constructive note from a major bank this week raised its estimate of drugs eventual peak sales, and the analyst writing it had a estimate the hazard ratio himself to get there. He put it somewhere between zero point 0.6 and zero point 0.7. Notice what that means. His guess is meaningfully weaker than 0.51, the number the release actually did print for the smaller, earlier trial. The most bullish case on the street is built on an assumed figure, and the assumption is worse than the only real figure anybody has. Now, here comes to the second point. A surrogate endpoint is not a survival. Recurrence free survival measures delays. It measures how long the disease stays away. That matters enormously to a patient. But overall survival, whether people actually live longer, has not read out. And adjuvant cancer trials have a long history of surrogate wins that narrow or occasionally disappear when survival finally matures. The endpoint that payers care most about is still pending. And the third one, this is one almost nobody mentions. This program has been turned down before. Moderna sought accelerated approval for this therapy back in 2024, and regulators didn't declined it. Management has said a positive interim result would make the case for an accelerated review. Make the case. That is an argument they intended to advance, not a decision anyone has handed them. As of this release, no submission has been filed, no filing date exists, and the medical meeting where the full data will be shown has not been named. And then there's the thing that gets lost entirely in a week like this. Every single dose of this therapy is manufactured individually. A patient's tumor is removed, sequenced, and a bespoke molecule encoding up to 34 targets unique to that person's cancer is built for them. That is a staggering scientific achievement. It is also a manufacturing problem nobody has solved at commercial scale. Tissue handling, sequencing turnaround, chain of custody, and scheduling across surgery, pathology, production, and infusion for every patient, one at a time. VYNG scores 5.8 out of 10. That is an standalone baseline. We have not previously published any conviction score on this company. So there is no prior quarter to stem from. Why 5.8 and not higher? Because the platform question has been answered and the magnitude question has not. A first in class phase 3 win against an active standard of care earns real conviction. A readout with no effect size, no mature survival data, and no regulatory filing cannot earn high conviction. However, loud the weak around it. We score the evidence as disclosed, not the narrative it supports. Again, it's not buy or sell recommendation, just our assessment of how much confidence today's evidence deserves. So, three questions next few months will answer. The number one, what is the hazard ratio? When the full data is presented, does it land at or below the phase 2B's 0.51 or up around 0.7, where the street is quietly assuming? Number two, does a regulatory filing actually get submitted with a date, a jurisdiction, and the time, an accelerated review that is not refused? Number three, where does the benefit concentrate? The trial pooled patients from stage 2B all the way through stage 4. If the effect sits mainly in the later stages, the number of patients this can actually help is a good deal smaller than the headline suggests. So, the real story this week is not that an mRNA cancer therapy worked, it's that we were told it worked and not told how well. And the word decided that that was enough. If you would like to explore every source calculation behind today's analysis, you will find complete research report on VYNG.io. Everything is sourced directly from Merck and Moderna's joint release, from Moderna's own filing, and from the trial registry. Because trust is not built by the confidence, it's built by transparency. I am Vikas. This has been What Changed from Wing. We don't report everything, we report what changed. Clarity, not clutter.